Mr. Kruger, thank you very much for your cooperation. You were very nice and patient with me, and I really appreciate that. And from what you've told me, this pain started when you were shoveling snow this morning, and it has happened twice in the past 7 years. You're a hypertensive, you're on the water pill, and you are a lawyer, so your job gets stressful. It has been stressful in the past. And when you told me that you do use cocaine occasionally, and your last use was last night, right?
That's true.
Anything else you want to add to that?
No, Doc, that's true.
Okay, so well, from what you've told me and after my examination, I can see that you did the right thing to come to the hospital because your condition needs urgent medical care. So what we are going to do is we are going to admit you because it is very dangerous to let you go in this condition.
Doc, I have an important hearing right now to attend. Can you just give me some pills so that I can get the pain away and leave work?
Well, as I said, your condition is very urgent. Let me tell you that this could be a very serious condition of the heart. And if we do let you go, then it is not in your best interest. It will be against my medical advice. I strongly suggest that you please try to postpone your meeting because this condition can be very dangerous to your life.
Okay, Doc.
Okay, I don't mean to scare you, but we need to put you on oxygen. We need to get you the pain medications and rush you for an EKG and for a portable chest X-ray and an echocardiogram. All of these things are going to test your heart and your lungs.
Okay, Doc.
And we'll also do your cardiac enzymes. This is very urgent and you need to be taken care of.
Mm-hmm.
Okay. So as I said, these pains that you're having can be a condition of the heart, which is one of them is called angina, in which you have these kinds of pain due to an interruption in the blood supply of the heart. It can also be a myocardial infarction, which is that some of the tissue of the heart gets damaged. It can be a problem in the conduction of the heart, which is called as cardiac arrhythmia. So all of these conditions would be diagnosed by the test that I just mentioned. Besides that, if all turns well, it can also be an exacerbation of the problem that you are having with the acidity. So it can also be because of that, and we'll test you for that as well by doing an endoscopy. Okay. So well, have you understood everything that I've told you? Do you have any questions for me?
No, Doc.
Okay, so I'm going to tell my nurse to rush in and give you all the appropriate medications and put you on oxygen, and we'll put you on a cardiopulmonary monitor as well so that we can monitor your breathing and your cardiac activity. And let me assure you, you're in good hands.
Okay, thank you.
So I'll see you soon. Okay? Nice to meet you.
This encounter was of a patient in acute pain, and this is another common case faced during the exam. I would like to point out here that if you come across such a case in the exam, don't lose your cool. Approach the case similar to how we've shown in the previous videos. The only thing different here is that concern for the patient should be reflected in your tone and your action. And you should first console the patient, and any patient with acute pain, the issue of pain management should be addressed upfront, emphasizing about the appropriate pain medication and pain relief. Also, I would like to mention that you should not give any false reassurances about the complexity of treatment or the severity of disease, as that might reflect negatively on the communication and interpersonal skills checklist. You should also address the issue of immediate admission and investigations in such patients. And if the patient is adamant that he or she does not want to get admitted, you should address the issue of leaving against medical advice. All in all, I would like to mention that if you come across such a case, maintain your cool and use the proper transitions and console the patient adequately and repeatedly, as it would help you in striking a rapport with such patients. One should not forget to take the history of recreational drug abuse, and if that is present, you should always ask about the mode of intake. And during the examination, don't forget to examine the cubital fossa of such patients, and if the patient is snorting cocaine, don't forget to examine the nasal septum.